Hi, everybody. Um, if you just watch my videos, something you may have seen on some of the more recent ones is this nifty handy dandy bracelet that says fall risk. That is because on November 15th, 16th, I don't know, whichever one was a Saturday. I think the 16th. Anyway, I broke my leg. And that is how I got this, super cool bracelet, which is very durable because now, as I'm filming this, it is December 31st. So it's lasted a good little while. I broke it pretty badly. So I have pictures, but I'm not going to share those. And what happened was I was out walking in a park and there was a hill that had a path on it in gravel, but it wasn't flat. And the gravel slid down the hill and I was on top of the gravel that slid, so I slid with it. And I fell, and I landed on my ankle, and I broke it. It could have been worse, and I'm very glad and grateful that it wasn't. It was a simple fracture. It didn't break through the skin or nothing like that. Broke just in one place, snapped completely through. No, splintering or scary stuff like that. It was really painful, and my dad was with me, and panic-stricken, incredibly guilt-ridden, he helped me get back into the car and we headed to the emergency room. And I got great care, and I'm really, really thankful for that. I really am. But I also got a great bill. So I put masking tape over pertinent information. But what I wanted to draw your attention to was both the total amount, which is $15,381, as well as the account balance, $2,862.27. That's just for the ER visit, folks. I had surgery after that. So that doesn't include the surgery. And it doesn't include any of the physical therapy or the boot that I got put on it so that, it would stabilize the joint. And since the physical therapy has just started and will be continuing into next year, that means I get to start with a whole brand new deductible and co-pays and a whole nother annual out-of-pocket. So my annual out-of-pocket, I think, is either $5,000 or $6,000. So I'm pretty confident, given that insurance is paying as much as it is, that I've probably hit the annual out-of-pocket for 2021. I'm hoping that it won't have to go so far that I max out in 2022 as well. And that's with insurance. And, it's going to be hard, but we'll get through it. It's going to be okay. I'll be okay. This isn't, I don't have a GoFundMe or anything like this. I'm okay. But what if I hadn't, what if we didn't have, strong savings? What if I was uninsured? And this isn't something that I could have avoided in any way by taking better care of myself. I was, outside, theoretically doing something healthy. Medical debt shouldn't be a thing, at all, for anybody. I remember this sort of experience is what first got me interested in public health care. The first time it really hit me was when I saw not the bill, but the explanation of benefits for one of my chemotherapy treatments back when I had cancer. I was like, it was about the same amount. It was $14,000 or $15,000. And that was back in 2011, I think. How much is your life worth? I broken the leg. I guess I could have, not done therapy and gone it on my own, and then I wouldn't have to worry about next year's deductible or paying for it. But, cancer is it's cancer. I didn't have a lethal case, but if you don't do something about it, then it's going to get worse. And eventually, it's going to kill you. So that comes back to how much is your life worth? And how much debt are you willing to go into to not die? So many nations provide public health care for their citizens. Every other industrialized nation in the world does this. And as a public teacher, I see that education is something that everyone benefits from, not just the students who are currently getting educated. I benefit from this new group of students being educated, not just because it's my paycheck, but also because we all benefit from having an educated citizenry. Likewise, when the people around me are healthy, or if they're sick, they can go to the doctor and, get treatment and medicine. And if their checkups are covered and they don't have to worry about paying for those, they're more likely to stay healthy. That means they're less likely to infect me. I benefit when other people are healthy. I don't understand. I don't understand. Nobody is saying that healthcare is free, especially me. I'm a teacher in a capitalist society. I need to get paid. Education is not free. K-12 public education, it's not free, okay? It's paid for by us, by the public. And there should be an option for everybody to have healthcare that's paid for by everybody. Just like public education doesn't mean that if you want something different, it's not available. There are private schools. If you have money and you choose to prioritize that, you have other options. My husband went to a private school. His parents had to make sacrifices because, they were a one-income household and they didn't have a lot of extra money, but they did what they could because that was a priority for them. And they were able to do so based on the resources that they had, and they were very fortunate. So if we have public health care, likewise, there will also be options for additional services, therapeutic treatment that goes beyond what's necessary and into not just elective, but optional treatments that make you feel better, even if it's not necessarily necessary for health. You just, comfort treatments. I think plastic surgery would probably, in most cases, fall under that. Some other therapeutic type treatments that may not be deemed medically necessary by your provider. And all of these are also issues that we deal with our current system with insurance as well. Your insurance provider can also say that treatment's not medically necessary, and then you have to go through all these hoops. So all of the arguments that I've ever heard against public health care are bringing up problems that currently exist in our non-public system. And I want people to get the health care that they need without being crippled financially. I don't think that's too much to ask. Leave me a comment. Bye, folks. Stay healthy.